whatever, then there's times, there's going to be situations like that. So one thing that you can do for the baby is to do some unwinding. The baby is upside down in the womb, so this isn't unusual for them to be upside down. But here is specifically how you do this. You want to hold on to the legs with 4 fingers, or all 4 of your fingers here. And then your thumb is going to put the feet into extension here, okay? And then you're going to lift up. And this baby should hang straight, okay?
We're going it out.
And you can swing for about 20 seconds.
Tummy crunches.
Yeah. And she's just working it out.
Yeah.
And she should, within 20 seconds, hang absolutely straight. Good.
Do you want to twist in their hips too? That's what we were.
Yeah, you can. She didn't need it. So, she just kind of, you can see how she initially just torqued a little bit. If you do that twice with the baby and they are still holding their head and twerking to one side more than the other, refer them to a pediatric chiropractor. Okay, so those are some really specific things to look for. Yes. I think it's good. It's good. Okay, I will hand her back to you. That is good.
You did so good.
Star of the show. So, adjustments for babies are very, very gentle. I'll use oftentimes some tools. This is called an activator. It's a spring-loaded tool. I will also use an arthrostim. Arthro is a medical term for joints, so it stimulates the joints in the spinal column, and it's more of a percussive motion. But generally, for babies, all they really need is hands-on manual adjusting. So I will also glove and check internally. So again, I check to see if the hard palate has dropped on one side more than the other. That is really common to see for those babies who have asymmetrical tone. Again, really rigid on one side, or holding the head to one side, not nursing as well on one side more than the other. So it's just making sure that we're doing a full body assessment, and sometimes it's a very simple thing, and sometimes it takes several adjustments. Babies respond very, very quickly because there's not scar tissue and degeneration and disc issues and all kinds of things that come along with age and time and trauma. Okay? The birth process is very traumatic for the baby, no matter which way you look at it. Okay? If you have a mom that you've had to refer for whatever reason that ends up in a C-section like my babies did, my first 2, it is very vital that they get some cranial sacral work. They miss out on the cranial squeeze of the molding. They miss out on the thoracic squeeze. And yeah, should have. Yeah. There's just so much that goes along with a C-section baby that is damaging and dangerous to the mom and the baby, but particularly for development. And it's really interesting to see the difference between my older 2 children and my younger 2 children. My younger 2 are like bright lights, and my older 2 have some. And is it directly correlated? Hard to say. There were some other lifestyle factors that went into the differences there too, but I want to say that that's a pretty major, significant life factor that is the same for my older 2 and my younger 2. So, even in terms of their, like how they're doing in school, my 3rd baby skipped 2nd grade, and my 4th is about to do the same thing next year. And then my older 2 are struggling in school. So it's the impact in the nervous system of the things that I didn't know back then. Again, it's all been experiential. and that we're still working out. But it's never too late to check a child. I have a mom recently that was a patient in my office, and she, after time, said, hey, could you check my daughter? Her daughter is 7, and she's been wetting the bed. And we always, again, have to look to the cause. There can be a lot of causes for bedwetting. There could be sexual trauma or things, like that we never want to overlook. For her pelvis was so misaligned from a traumatic birth experience. One adjustment, she never wet the bed again. So, I just think, imagine if these kids were just getting checked proactively and preventatively of the positive impact that would have on their life down the road, okay? So these are things that are important to look at and to look for, and just encourage the mom. Like if a mom knew, and this is what Holly said to me on the phone this morning, she said, I think if a mom knew that their baby would latch better, sleep better, have better digestion, be easier to calm, that everybody would want to get their baby checked. It just seems like a no-brainer, And it's not, chiropractic has been known to be a neck pain, back pain, and headache profession. But that's not what it was founded upon. It was founded upon the health of the nervous system. The brain controls everything in the body. The spinal cord connects to it and carries the messages to and from. Why would an adjustment help a 7-year-old girl not wet the bed again? Not because she has back pain. It's because there is interference in her body's ability to communicate normally. And so the same thing will happen with colic type, things that have been named colic, like suddenly the baby calms and better. Suddenly babies having normal bowel movements.
Well, I always advise my girls to take extra diapers and clothes to their chiropractor visits.
Yes, it is a
If you're
very...
gonna stop that baby, make sure you've got extra clothes and a diaper.
Oh yeah. By the time you get home, it would have been taken care of for sure. Like once they leave, it is a funny thing in our office where they'll say, "Oh, here it comes." Even sometimes we're just doing cranial work. That connection, balancing the vagus nerve, that is a cranial nerve coming out at C1, the atlas, the top bone in the neck. That cranial nerve goes to every organ system in your body. If that's imbalanced, and imagine a really challenging birth, that's going to put pressure in that top part of the neck and affect everything down below. Okay. You could prevent chronic colds and flus and ear infections by having a baby check. This top bone in the neck should look, we don't x-ray babies and toddlers unless there's a trauma, but what I have found for ones that we have x-ray is the babies that have, or the young children that have flat atlases, they should look like they're taking off like an airplane and have a C-shaped curve in the neck. Those are the children that will have chronic ear infections. And that is just a physiological event. If that atlas isn't in the right position, the eustachian tubes can't drain. So that is another really common reason why parents and moms would refer a baby to a chiropractor. So we also have I do have a nurse practitioner on staff, and so if it is a really raging ear infection, I will have her look at it, just in case. But oftentimes we have something called ozone in our office where it's air. And we put a syringe full of ozone in a baby's ear and it takes care of the infection when infection is present. And then adjustments help it to stay clear. So there are just some really proactive things that we do that are state of the art and allow moms to prevent medicine. It's there if we need it, but usually we don't need it. And we always say the best practice of medicine is how to teach people how to prevent needing it. So, okay, a couple chiropractors in the Little Rock area that see peds are Dr. Courtney Carmack. She is with Hope Family Chiropractic. She worked in my office for about 7 years and adjusted me through my pregnancies. Dr. John Vincent has seen peds for years as well. And then I, of course, see peds in my practice. And I want to give you all my cell phone number. So if you have a mom that needs to be seen and you'd like to get her in with me, you can send me her contact information and I will have my team call her directly to get scheduled with me. Okay, so I just want you to know that that's available. And I want you to know that I'm available for any questions you might have. You know, if you have a mom that is stalled in labor, or if you have a mom that has a breech presentation and nothing else is working. These are reasons and that I see pregnant moms in my practice, tons of them. So it's become a passion just by accident. You know, I didn't go into chiropractic knowing I'm gonna be pediatric chiropractor and prenatal and postnatal chiropractor, but
There's hardly no men that come.
yeah, I do
They're
see
just
primarily.
pregnant women.
Yeah, I do see primarily women and kids in my practice. We also, this is just kind of new and interesting and fun modality that I have in my practice that we just added is called a Gazelle pulsed electromagnetic frequency chair that is FDA cleared for incontinence and for pelvic floor dysfunction. So I know you're getting a PT talking about that tomorrow and teaching women how to do internal work and or maybe she's doing internal work, but the incontinence world is a secret world, and particularly with moms and women. You know, I was talking with my mother and we're talking about this, and I realized, I'm like, oh my gosh, she keeps pads with her all the time. Like she had a hysterectomy when she was like 32. And she's had incontinence my whole life, and I just never realized it. I never really asked her, like, why do you wear a panty liner all the time? And so there's two different kinds of incontinence. There's stress incontinence. That's the times where you're just running or bouncing on a trampoline where you just have leakage. And then there's an urgency incontinence where women are getting up in the middle of the night many times a night, like 3 or 4 or 5 times a night to go to the restroom. And that's not normal. It's not normal. It means that the pelvic floor has dysfunction and weakness. And so the bladder muscles. And so we have like an 80 to 90% improvement in pelvic floor dysfunction for stress and urgency incontinence. And sometimes there's mixed. Oftentimes women will have both of those. So if that's you, or if you know of anybody that has that, we could do a demo on that modality. It's a 20-minute treatment. A demo we could do for 2 to 3 minutes just to see what that's like, of how that activates the deep muscles of the pelvic floor. It's really, really incredible. So, okay, I want to open it up for questions, and then I'll be here to answer any private questions that anybody has. Any questions specifically on assessing the newborn spine, chiropractic for pregnant mamas? Yes.
What would you say because you're recommending referral in like these instances, what would you say when that's like a financial difficulty for someone? How can you help them either like choose to do it, or how would you prioritize how much or how often they should be seen?
Yeah, that's a great question. One of the things that we always do in our office is go over the financial piece up front. We want to make sure that there's no surprises. And so I brought with me a bodywork package referral gift card that would allow you to have that first visit free before we do anything. So we could do an assessment similar to what I did here, and then talk about, okay, this is what this would look like. This is how many visits I would expect the baby would need based on what we're seeing. Sometimes it's a lot fast. I mean, sometimes a baby clears in 1 or 2 visits. Sometimes it's more like 6 to 12, depending on the severity of what's going on. But that way we can present my team, we can present the information. And if there is some level of musculoskeletal imbalance, insurance will apply to that. So particularly this time of year, most of the time, deductibles have been met, and so there's really maybe a copay or a small co-insurance or nothing if the deductibles have been met responsibility. So, but like let's say that a mom absolutely cannot afford it, or it's very minimal, then we would just have a conversation and say, what can you do? In extreme instances, we have hardship situations or payment options for
Our kids, does it pay you?
We are not in network with our kids. We're not.
And better?
We are in network with Ambetter, yes.
They seem to be a little better about chiropractor care than United.
Yes, we are in network with United too. It's,
Midwest can be providers in United now. I just got on their list.
okay. Yeah, very few chiropractors are in network with United Healthcare. Their reimbursement is so poor. It almost costs us money to be in network with them. But the amount of care that they allow is so minimal too, that then we have to have a conversation about when insurance benefits are maxed out, what do we do then? So again, that's all on the front end so they can make informed decisions on their health and not get a surprise bill in the mail.
But
Yes.
if it's a brand new baby, do you do cash pay? Just, I mean, it feels like if you could get to the babies right from the beginning, you might be able to not have to see them for an extended time.
Right.
Yeah.
Yes, and oftentimes if, like, I recently just saw a baby that was 4 months old, and it's taken us, he's on his 7th visit now, and then I'm seeing him this week, and then we're gonna go 2 weeks, check him after Thanksgiving and see how he's doing, and I think he's gonna be okay, but that's gonna be like 9 visits, where if I would have seen him in the beginning, I think he would have cleared in 2.
Right.
So that is one thing to have you can pay later, pay more, kind of thing. Yeah, that's a great question.
What do you do for tongue-tied babies?
So it depends on, we want to assess the grade of the tie first and how many. Is there upper and lower lip? Is there tongue? Is there any buccal, like lateral ties? And then just determine if there's a referral. And I'm very, and I think most of you in here, if you do refer, you're referring to a laser pediatric dentist. It is so important to do that.
We do have a new one here in town.
Okay. Is he new? I always say, don't go to the new guy. Let other people be the new guy.
One of my clients found him, so I don't know.
Okay. Send me his name. Or,
Not pediodontist. Yeah.
okay.
Pinnacle is the name.
Pinnacle. Yeah, I still refer to
Hamilton?
I do, because he's been doing it a long time. He's not as busy as he used to be, and I think it's because there's other pediatric dentists who are doing it now. But I have, I've had a mom say, well, I don't want to pay the money for it. It's like cash, it's out of pocket.
It's really gone up.
It's gone up, but then they'll go to the new guy in Conway and then have to have a double revision. Or they'll go to the pediatrician because they can get their insurance to cover it, and then it's thicker
scissors.
and right back to where it was, and it's done with the scissors. And I'm like, you could do that at home, for Pete's sake, So, I'm like, if I was gonna get a knee replacement, I'd want to go to the guy who's done the most knees for the longest amount of time, So, I still recommend Dr. Hamilton, hands down 100%. If you're having a hard time getting in with him, drop my name. Just tell the mom to drop my name. Say, Dr. Kiernan referred me, and he'll generally get you in a couple of days. So,
I think it's more the price is keeping people, because it's like $1,200 front.
yeah.
And they're taking the insurance.
And then you have to pay for the consultation too, don't they?
Yeah.
Whether or not you do it, I think they have to pay.
And I think it's per tie, isn't it? Is it there a price per tie too?
Maybe.
So if you've got a kid with a bunch of ties,
I know like the one in Conway is.
okay, maybe it's fine.
So I think the biggest thing, once the tie is revised, if they choose to do that, is to make sure that and encourage the mom to do the stretches. That's a really important piece. It's hard on them. They don't like doing it. The baby doesn't like it. And then I like to see the baby right before the revision, and then 2 visits minimum after, because there's a big change in midline and everything going on there that happens, and we want to make sure that that is appropriately moving in the right way. So.
Do pediatric chiropractors also normally do toddlers on up through childhood, or is
Most do. I do.
it still helps with midline and such?
Yes. Yeah.
So is somebody done a revision done? Is there something that you do to help?
I will either encourage the mom one way or the other. Like if it's a grade 1 tie and the baby's gaining weight and nursing well and latching well and the mom's not in a terrible amount of pain, I'll say just keep going. And because there's no reason to endure the hardship of the revision and the financial, impact of that. And there's a lot that we can do just in the internal that we can
That's
help with that.
what do you do?
So part of it is just cranial work is going to help. We might do some stretching just of the frenulum, some, and then kind of teach the mom how to do some upward movement too. But I'm hesitant on telling too much on that, because if it is a tie that's significant, that's going to impact a lot more down the road. Like the baby might be latching and nursing fine, but then 2-3 months we're having gassy, uncomfortable baby and some other issues that are coming up just because there's a tie there. And speech impediments, yes, for sure.
Food aversions?
Yeah, swallowing issue. I mean, there's a whole host of things that can go along with that.
What's wrong with the old-fashioned clipping?
Well, it's kind of
It's
can
like-
scar and sometimes grows right back and
If you
worse.
just keep stretching out it.
The pediatrician that they tell the parents to not touch it.
Oh.
They
They
say
don't
leave it
believe it.
alone, and they
Because
don't.
I had a baby last night that the pediatrician clipped. It was pretty tight,
Yeah.
and she didn't want to, but the mom told her to, and she clipped it, and looks great,
Okay. Good.
you know.
They do it at children's, don't they?
They do
Yeah.
actually. They clip with a scissors.
They also have a laser
At
one at children's.
Oh, do they?
Yeah, because my
I
son
think it
was.
depends on the pediatrician.
Yeah, my son was a laser one at children's when he was almost 12 weeks old.
Do they take insurance at children's?
Yeah. They did all the way through. So yeah, and they had a lactation consultant. It was really easy to work with and everything when they were done.
Maybe you could get Deb the name of that pediatrician specifically who does it.
Yeah, it's like a lactation clinic.
Summer
Right? A client of mine just recently went and had the best experience.
They did it in the
There's a
area.
pediatrician that's an IBCLC, and
they.
so they do like tongue and lip ties, and they have all this. Yeah, it sounds.
Well,
like
they did it in the
Can you
ear,
get
nose,
that
and throat.
information?
That
Yeah,
section.
ENT at ACH, ENT at Children's will do it. They did,
Laser?
double buckle and a pretty severe tie on my youngest.
We had
With
lip,
laser.
both
Yeah.
sides and bottom.
He was getting throat done too, though. He was
Great.
getting
That would
floppy
be
nose.
really great if we could send that out. to
They've
them.
gotten so pricey that people are just not doing it anymore.
Right.
But
Yeah.
yeah, children's takes Medicaid
Yeah,
and they're
Medicaid
awesome.
Great. That's good to know.
Out of curiosity, have any veteran midwives done any releases in a home birth type setting? I saw
Yes.
it once by a midwife in another state, and it was simple, quick, but I don't know what happened afterwards to that baby.
I've done like-
I'm just curious, because I've done a few of them, and I just didn't know if that's something that midwives are still doing.
My first got it done, my own son, his like 10 minutes after delivery. My midwife in Kansas checked all babies because like 11 of all her 11 kids had really bad ties, and they didn't get fixed till they were like 10, and they had horrible speech problems and waking up in the night all the time and all these other issues. And yeah, she numbed him with a piece of ice and then clipped it before he even latched. I mean, would I do that now if I had a baby? I don't know, but but that was 9 years ago, and
Yeah, you never know.
Okay. Any other questions for me?
What's your cell number?
My cell phone number is 501 766 8280, and it's Tracy, Traci. Kiernan is the last name, Kiernan. If you're gonna call me, just send me a text first and let me know who you are so I know to answer. Otherwise, I will send you right to voicemail.
Would you know any chiropractors? I'm from Mountain Home, Arkansas, that do, we have a lot of chiropractors.
Yeah, let me,
Melinda, do your people go to Springfield? Or where do they go?
Oh, that's 2 hours away.
Dr. Cash up there.
Savannah has more and all that.
I don't know of anybody specifically. I have a doctor who worked for me for about 7 years. That's from Mountain Home. I could reach out to him.
Yeah.
For new, the new Webster certified, I just saw it.
Oh,
Don't look at me Yeah, I haven't been.
My girls both want to be
I
chiropractors.
daughter like a week or two.
We'll see, I'm not pushing it.
Always wanted to say.
I'm a chiropractor, doctor of chiropractor. Yeah.
Okay.
Any other questions? Everybody has my cell phone number. I'm gonna hand out, I have some cards, and then I have these bodywork packages.
I can use a little cash up. I'm
Okay.
going out all the time.
Great. Well, if anybody wants more of these, I'm just gonna hand these around. There's business cards, and then this is kind of like a gift certificate. So if you have a mama or you just wanna get help, you know, that this is no obligation. It's kind of nice, right? They can just kind of come in and meet us and see what it feels like. I always tell patients, don't do something that you don't feel peaceful about. If somebody's trying to force you to do something, you get that, like me with that nurse, like I want a different nurse. We gotta teach them to honor what that is. And so, anyway, this is kind of nice. So if they come in and are like, ugh, and it really wasn't our thing, then there's no harm with that. So I'll pass these around. I'll leave those with you, and then if you need more, I'm happy to get you some more.
Business cards, more of your business cards.
Any other questions for me? It's a miracle. I'm like right on time. I usually always go over. Baby Sayla made it easy. She was the star of the show. Precious little.